Hey everybody, I want to welcome you back to our YouTube channel. I'm Dr. Steve Schlintz, and today we're going to talk about something very common with patients using this scan and this patient to go through that can't you just fill it scenario. This is actually a patient that was seen in our practice, and she was experiencing some chipping of her teeth, and in particular her upper right canine tooth, which in this guy is right here. Okay. Now, the difficulty with her case is that when you look at her teeth, she actually has really nice teeth. The issue is that we have done a previous bonding about a couple years ago, and it's chipped off. And so I immediately start to look at why is that the case, and what do we do about it to make sure that that doesn't happen in the future. Now, the reason this is so important is that when we're going through the scan together, you should be able to see actually why the bonding is chipping off and what we do about it in the future. Okay, and so I bring this up because a lot of times patients will ask me, well, why can't I just fill it, or why can't you just ground it down more? Both of those scenarios in this case will not work very well, and as a result, I had this discussion with the patient. Now, we'll go through the first case scenario here. So I'm going to bring this up here. And what you'll notice is this guy right here. This is the chip for this patient, okay? If you compare that to this side, you'll see a unworn canine, and it's kind of got this oval appearance. And if you go over here, you'll see there's a straight line, and it's hard to tell on a scan, but this whole front part of the tooth has chipped. Now, this is where the existing bonding was. Now, if we grind this down, if I try to smooth this, what will end up happening is that these teeth will now have some freedom. They won't be hitting each other. But over time, because these canine teeth are not hitting each other, they'll actually start to erupt. They'll come out just a little bit to get contact again. And as soon as it happens, it's going to look worse. And if we grind these teeth down to create space and make them look a little bit more aesthetic, you'll end up having flatter looking teeth, which is not what you want when you're in your 20s or 30s or even 40s or 60s, 70s, 80s. You never want flat, worn down looking teeth, correct? Okay, so if we know we can't grind this down, then the option becomes, do we fill this? Now, if I try to fill this area with the way her bite is, and I'm going to explain why her bite is creating issues for her. If I try to fill this without really reducing a lot of tooth structure, and we just add to what's already there, I can almost guarantee you within a couple of years it will probably chip again. Okay, so that's not a long-term solution either. Now, if she was going to a wedding or something like that and she wanted to fix for the next few weeks, I would go ahead and do the filling. But for all intents and purposes, that won't hold up very well. Okay. Now, if I take more tooth structure away in order to get the bonding on, that will work. But we're reducing a lot of tooth structure in order to get the bonding to work. So that's not an ideal solution either, okay? Now, the main thing that we can try to do is actually correct the alignment on the teeth so that there's not as much stress on this one particular canine. And when I looked at her scan, this is what I noticed. So I'm going to bring the scan back out. If I compare this alignment of these canines with this alignment, you'll notice there's a difference. And what you'll notice is that this upper canine on her left side has a better relationship with her lower teeth than this one on the right. This one on the right, this canine has actually moved towards her cheek or towards her lip, and that creates a very unusual biting force on these two teeth. And so if I look at just her bottom teeth, for example, and I bring the scan this way, okay, what you'll notice is that all of these teeth on her left side are in alignment. So you see alignment, 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 all the way back, right? The teeth line up. And then if I look at this guy, we see, not in alignment anymore. That tooth is actually rotated over time and come out towards her cheek, which creates a really unnatural bite on this tooth and the tooth above it. Okay, that's what's creating the issue for her when she goes to just bond the tooth. This tooth and the tooth that we're bonding to are hitting in an abnormal position, which creates more force on that tooth that has the bonding, which causes it to break or chip or crack. So unless we do a crown or a veneer, and a veneer wouldn't work very well either you would have to do a crown here to protect the whole tooth, you're not going to get the aesthetic result you want. And even if we do a crown, now we're doing just one single crown, which never looks as good as if you did multiple crowns in the front, right? So the treatment plan for this patient, ideally, is actually to bring this tooth back into alignment using some type of clear aligner system. For us, it would be Invisalign in this case. We bring this tooth back into alignment, and then once that tooth is in alignment, then we can go back and do the bonding on this top tooth to correct this chipping, but now we know it's going to be a more lasting solution, and ultimately all the other teeth will also be in better alignment, and she's going to be able to get this replaced without reducing additional tooth structure, which is what we're looking for here at this office at Harmony. So her case is pretty straightforward, but it's a very common question we get asked all the time: why can't I just bond it? And the reality is, if we just bond it the way that it currently is, it will chip. In order to get bonding to work, we have to reduce a lot more tooth structure than what I feel comfortable with. And the best case scenario for her is actually to bring these teeth back into alignment, have her wear retainers, and then ultimately come back and do the cosmetic bonding if that's what she's interested in. So hopefully you guys got some value from this video. This is, like I said, a very common thing that we see all the time in our practice. We spend a lot of time with TMJ patients, severe wear cases, but sometimes cases like this are deceivingly challenging because she's had bonding at least once since I've known her, and maybe she had it in the past as well, and now she's coming back and having the bonding chip. So in order to rebond, we have to start to think about what is actually causing this problem. So it doesn't always have to be the hardest cases to do Invisalign, and in fact, a lot of these cases, this is what Invisalign was created for, and clear aligners just in general. When we have slight movements like that, it's easy to bring this tooth back into alignment, make sure that we're doing it in a way that she's still getting a good balanced bite, and then we come back and do the bonding that we want to give her the result that she's looking for. So as I said, hopefully you guys got value from this video. Be sure to check out the other YouTube videos on this page. And as always, if you guys have any questions for me, leave them in the comments below. And you are more than welcome to book an appointment with us here in Fort Washington, Pennsylvania. Even if you're from out of state, we'd love to see you. And we have patients from out of state, so it can be done. I'll leave it at that. So with that being said, guys, take care, and I'll see you at the next video.